welcome everyone, and thank you for joining us for another conversation hosted by Missing Pieces Support Group, where we help women and families with life after pregnancy loss. Today, I am so super excited because we're bringing together two mental health professionals who have become valued friends and supporters of our organization. Amy Zulko is the founder of Two Roads Recovery and a longtime friend of Missing Pieces Support Group through our BNI community. She has supported our maternal mental health symposium as a sponsor and continues to be an advocate for trauma-informed mental health care and emotional wellness. And if you're in the Houston area in October, you'll probably see her as the sponsoring vendor at our 5K, which I'm super excited to talk to her about. Also, Dr. Abigail Weissman is a clinical psychologist, EMDR trained therapist, educator, consultant, and founder of Wave Psychological Services. We met through the Institute of Reproductive Grief Care Symposium while serving on a panel focused on underserved communities and quickly, like this, guys, quickly connected through a shared commitment to helping people feel seen, supported, and understood. Thank you both for joining us today. Are you excited for this conversation?
As excited as you can be to talk about trauma and grief, of course. But I'm just grateful to be here with you. It's always a pleasure, Jamilah. Yes. And again, Abby, great to meet you.
Yeah, I think that's the part I'm most excited about is that I get to see you all's faces. And I know the energy and passion that you bring to your professions. And can't wait to hear the content that you share with the rest of us. Okay, let's dive right on in. So let's begin with a brag question. And Abby, I'd like you to take the lead with this one. When someone experiences pregnancy loss, what is something you wish more people understood about grief that often gets overlooked?
I'm so sorry. I had a brief interruption by my living 8-year-old.
It's okay. Life happens.
Okay. Will you please repeat the question so I may be attentive?
Yes.
Thank you.
We're going to start with a brag question.
Okay.
We take the first stab at it. When someone experiences pregnancy loss, what is something you wish more people understood about grief that commonly gets overlooked?
That it really matters. People are really hurting. It's important and needs to be noticed and seen. And I hear so many stories of people saying, not demeaning, but minimizing their own experience, and then the people around them minimize their own experience. But to really see that it matters and it's brutal.
I would agree. Feeling seen it's key. What's your take on that, Amy?
One of the biggest things is that I work with clients is the importance of honoring all of the emotions that come with that experience, right? And so honoring all of them, especially the ones that don't make sense, and the ones that we don't want to feel, and how there can be so many different competing and conflicting opposite sides of the spectrum that we are going through, and that is completely normal. It kind of plays off of what you were just talking about, just the experience that they're having and then feeling not normal in that process, as in like what is normal in grief, right?
Yeah, I would totally agree. It's almost like you have to learn a new normal.
Yes.
At this point, because what you were used to does not exist anymore.
Nope.
And a lot of, first-time moms don't even think about, this side of pregnancy because the other side, the happy path, is so normalized and talked about, whereas pregnancy loss gets a little bit overlooked in conversation. And so you're trying to navigate the waters sometimes solo. Thankfully, there are professionals like you two that can help us talk through those issues. Amy, this one's for you, friend. Many people in our community have heard the term EMDR, but may not fully understand what it is. Can you explain EMDR in everyday terms and why it can be particularly effective for people carrying traumatic aspects of loss and pregnancy loss?
Absolutely. I like to call it the 35,000 foot overview, because to get down into the nuance of what EMDR is and what it can do and what you can do with the protocol could take, hours. One of my favorite things to talk about. But the short and skinny of it really is the metabolization of trauma. And by that, it really is trauma overwhelming the system, and it becomes stuck as like an emotional or somatic memory without having a reconciling narrative to attach to it, right? So like a normal memory, a normal experience, you have all five senses feeding into your body, and then you also have that ticker tape narrative that's, attaching to the experience. Like you hear me talking where you're sitting, being outside on a warm day, all of those things, right? But when we experience trauma, there's a disconnect there. It's your brain goes into survival mode and it overwhelms the system. So negative core beliefs develop from this, and as it relates to pregnancy loss and grief, you can develop I'm not good enough, this is my fault, or in some very severe cases, right, I don't deserve to live, with a level of survivor's guilt. And what happens is EMDR uses what it's referred to as either BLS or DAS, depending, it's interchangeable in the literature, right? But dual attention stimulation, which works to keep the client in the present moment, to be able to desensitize, right, to the somatic and emotional overwhelm of the experience, while simultaneously trying to install a reconciling story around that experience, right? What I tell my clients is that it's not a magic wand, right? We can't erase the past. We can't make it not happen. The reality is that this did happen. This experience did happen. It was awful. How do we move forward with a level of radical acceptance? Doesn't mean we have to be happy about it, right? And that is the most succinct way that I hope I put that together in the best way I can.
Let me ask you this follow-up question. How do you recognize when someone may be experiencing trauma in addition to grief? Or, are those two even separate items?
I would say no, but if I'm going to put and I hate doing this, right, my pathologizing hat on, it's when those systems persist for longer than a month, according to the DSM, right? I don't know anybody who can grieve any kind of loss, much less pregnancy loss, in a month. So in my mind, I do believe they're interchangeable. I think the most critical component of that is when the individual notices that there has been a substantial shift in how they view not only the world around them, but how they view themselves in particular. And that enduring feeling is what leads to people that start to meet the criteria for post-traumatic stress disorder. Most people have post-traumatic stress from this experience, which is, i.e., grief. But for it to shift into clinical significance, right, it has to endure. And then we have those oscillating kind of like avoidance and emotionality that goes along with it. So I would say that they are the same. I would say that, clinically significant levels when it moves into a post-traumatic stress disorder, is the enduring longer term effects of that.
Gotcha.
And
go ahead, Abby. I was just about to ask you, did you have anything you would like to add to that part of the conversation?
Please ask. So that's perfect. Thank you. Yeah,
Yes.
what I've heard, and that was an amazingly succinct explanation for lifetimes of study, and lots and lots and lots and lots and lots and lots of people talking about these important topics. Two things. One, with EMDR, what I was taught was that a lot of people have memories of bad things that happened. I was so surprised when I first learned this, that you can look back at something bad that happened and be like, oh, that happened, but it doesn't influence the rest of my life. It's just a bad thing. But memories that weren't encoded or processed correctly in the system leave scars,
Mhm.
that change how people perceive themselves. And so
Yes.
what I was taught was that EMDR will help people process them correctly. So that when you look back, it's like, oh yeah, this terrible thing happened. I'm obviously not happy about it, but it doesn't impact my future. EMDR helps like clean things out so the body can process it. And I just think it's so neat. It was very annoying when it started working because I was like, I've spent my whole life learning how to be a talk therapist, and you're telling me that I can do this cool thing. And I've been struggling for years.
But that makes so much sense.
Hey,
No, it makes so much sense because it's somebody that has gone through this type of grief, you're in a shock, and then you try to compartmentalize so that you can just deal with life, right?
of
But
course.
if you deal with those feelings, they are always there, just sitting, waiting to be processed. Like, hello, pay attention to me. And a lot of moms in this situation have to eventually say, yes, I'm ready to process. I'm ready to grieve and move forward so that they can move forward in a healthy manner.
Yeah, healthy. It's weird though. I mean, some of the things, Amy, that like I love teaching are how to compartmentalize, because that is not my personal skill set. For some clients, they're amazing.
Me neither. Me neither.
For someone like me who's like all over the place, that was something I had to learn. And then the other thing is I learned it was a year. So that grieving took a year. And if it was anything longer than that, then something was up. And so it became complicated bereavement. And that had its own classification. What I was taught was that grief is natural. And so you don't need to process it away.
Right.
But when it gets complicated, when it stirs up other things, when it, people aren't moving through it, they're just sort of stuck. That's when we can come in and be supportive in a different way.
Yes.
Yeah. Okay, this one's for you. One of the themes that emerged during the Institute of Reproductive Grief Care Symposium, and despite the title, it was an amazing, awesome conference.
Amazing. Oh my God.
The right people were in the room and they got to meet and talk. Anyways, was one of the things was the importance of understanding the whole person, not just the loss experience. Why is that perspective so important when supporting bereaved parents?
Great question. And an amazing conference. Just want to shout out. It was one of the most supportive conferences I've ever been to, where people were really present with each other and kind, deeply kind. The importance of having identity, though, or recognizing other people's cultural stories and where they are in the world, is that I'll speak for myself. I can really attune to what they need, not what I think they need based on like a generalization, but when someone will share how their identities look in the world, it allows me to provide resources that are specific to them. Be it their sex, and for me, I focus on sexuality and gender identity and religion. I'm also looking at like acculturation and race and socioeconomic status. Where can I find support for people, and how can I speak to them specifically, not to like, well, the research says that you should be happy now,
Yeah.
Oh,
you got comments about that, Amy? Because I got a comment about that.
No, I couldn't agree more. Like I consider same concept, different flavor, right? I work with a lot of substance use. I'm sure it's trauma, substance use, self-soothing. Like it's just there. That it's just always there. And I've gone through treatment myself. I've long-term recovery, and it is I go above and beyond based on what those clients need. I embrace all pathways to recovery. Harm reduction is critical. And being able to attune to what those clients need when they are trying to navigate the shame of not only dealing with grief or not only dealing with trauma, but also that they should know better than to be drinking too much or taking pain, like whatever their DOC is inconsequential, right? But being able to attune to not only where they're at, carrying the shame of the experience, the shame of the coping mechanisms that they're using, and then to tap into the cultural experience of that too, right? Like where they're at socioeconomically, what their where their identity sits in the climate that we're in right now, which we don't even have time to go into that at all. Wish we could. But I just to say that I wholeheartedly agree. We have to help. We have to attune to that. If we are, as clinicians, as helpers, not incorporating that cultural aspect, we are doing a disservice. We are not helping. We are not helpers. Period. No, I absolutely agree.
This theme actually kind of surfaced itself at our maternal health symposium because the physical health is something that's being treated in compartments instead of looked at holistically. And so women, especially if they don't even know how to advocate for themselves, they're seeing it as a whole person, and they're only getting the symptoms treated, which is a true disservice.
Yes.
So you can encounter somebody that's going to say, hey, let's take the time to look at all of these things.
Yes.
Figure out how we can move forward. So thank you for that response, Abby. Another thing about the symposium, we learned about the upcoming RG Care 5 screening tool designed to help identify individuals who may be at risk for complicated grief, which you touched on a little bit. What stood out to most to you about this work, and why could it be such an important advancement for reproductive grief care?
I think it's an amazing resource. I think the idea that something could be a 5-question screener and still find people who could slip through the cracks is freaking amazing.
Yes.
Yeah.
Like, okay. I mean, I've done a lot of the other work and tried to use like the different screeners and change them, but I know every time I'm changing the wording of them, my wording hasn't been validated, like it's not repeatable. It's not actually a valid measure. It's just me trying to make it work for the community that I serve. So this idea that a 5-question screener could help kind of find people who would slip through the cracks is vital to me. I love that like eventually it's going to be uploaded into electronic health records so that it'll just appear, won't have to be asked for. And then my hope is that it'll continue and be either, I don't know if they need it as a repeated measure, but that the answers from the questions will appear somehow in a block that says, don't forget this person screened positive for experiencing bereavement complications.
So to me, it sounds like you're already taking a next step when you identify something that seems off. But if the screening tool identifies someone as being at a higher risk for complicated grief, what should happen next?
Why were you asking that and thinking, oh, I don't know. So I will give an appropriate psychologist answer, which is it depends. It depends on all the factors that we mentioned before.
That's fair, because it could be anything.
And they said that up to 60% of people will experience this like complicated bereavement after loss. So 60%, I mean, that's people. Yeah. That's a lot of people that could be helped and could be seen and stuff. So being able to track people and then connecting them to appropriate resources, I think is vital. Finding community support, of which, not everyone is lucky enough to have your group nearby. So like your group. I remember you talked about your care package that you send and things like that. So figuring out ways to connect people, and then also finding them therapists that are trained to address this kind of grief. I mean, I don't know about you, but the folks that went to that conference it felt like almost a never ending empathic bones in their body. Like not just one bone.
In the room understood the assignment. Compassionate care. Treat people with compassionate care. See them holistically. And then move forward with the next step. And your response makes total sense, because we're going to have to see what comes out in the wash after the complicated grief is flagged. Like, what is the next step community support wise for this person?
Yes.
So
and a way of not feeling isolated.
Yes.
I'm trying to think, like, we were really lucky to have a live birth after our home birth. It was a home birth. It was I could imagine it being incredibly isolating. It was isolating for me, and I wasn't even the gestational mom. But to know that it was hard to know who community was at that point, because no one had our quite experience. And yet, how can you connect? How can you cope with the shame enough to be able to ask for help or know that help is provided? I also really like in the screener, and then I'll stop talking about how awesome the screener is, but how they are now in the stage where they're validating for word choice on the screener. They're only, and I mean, I'm a little sad about this because I didn't finish my first sentence, but they're only looking at women. And for most people, that's fine. The birthing parent is a woman. I tend to see people who are also men who are giving birth and who are trans men. So they're left out of the screener. But they're asking people from different communities to speak to the word choice of the screener, which I think is both important and of course, and also like, go you all, you're trying to be really on it. And that's freaking fabulous.
Yeah, I agree. One step at a time, right?
Yeah, but they're always looking for people to fill out surveys. And so right now they're in the recruiting stages for the next bit of validating this survey so people can help.
Wonderful. So the community has to do its part too and respond.
Yeah.
Amy, this one's for you. Many grieving parents assume therapy is only necessary if they are in crisis. What are some signs that someone navigating pregnancy loss might benefit from working with a therapist, even if they appear to be functioning well on the outside?
So what I like to say is, I think there's only so much that you can unpack with someone within their standard social and familial constellation, right? Like we've been kind of talking about this throughout the podcast about feeling isolated and what to do in community supports, right? Like the simple act of being able to unpack, again, all of those emotions that we talked about that feel really icky or maybe don't make sense in that situation. And you're surrounded by folks that necessarily, I'm so sorry, I'm so sorry for your loss, or, how can I help? Right. And what if you don't know how, you don't have the words? And so to be able to get there and be in a space with, somebody who specializes in this ability to be able to support folks, I think is important. I say all the time in the context of therapy should always be proactive and not reactive, right? I have never met a person in my life that could not benefit from therapy. And so that being said, right, we want to be able to proactively be working on the tools, working on the community supports, being able to establish those kinds of networks when we can, so that when inevitably life be lifing, we have the tools already in place to hopefully be able to regulate and have an expanded window of tolerance to be able to stay within that space to move through it. Or we have an established relationship with a clinician that, either is set up for success to be able to navigate through whatever this traumatic or heavy experience is. Or if they're a good clinician, they've got a strong referral network to be able to refer out to a specialist who can absolutely focus on that. I've talked to Jamilah about that through our connection with BNI. You know, we don't gatekeep around here. Like I'm great for a large group of people, I feel like, right? But I'm not going to fit everyone.
Right.
And then there's also the cultural aspect that goes into that as well. I have, you know, a very strong type cohort network and a therapist referral network in Houston, which I feel like is extremely important. We are the most diverse city in the US, and we're that way for a reason, right? I should be able to say to a Hispanic woman who wants to speak to somebody who's fluent in Spanish and understands the background and the machismo that they might be experiencing in the household, right?
Mm-hmm.
Love you. I have 3 therapists I can send you right now that fit that bill, right? Like, and so that I feel like that is also important, not only to look at therapy as a, you know, holistic wellness, right? It is something that should be proactive, but also, man, different strokes for different folks. And there's so many beautifully, wonderfully unique, talented human beings that are in this field with me that I am happy to share, because they will fit certain people in ways that I never could.
I love that answer.
Right on.
Yeah, just to stress the point of therapy is holistic healthcare. There is nothing worse than being in a devastating situation like loss, and then trying to search for someone that can help you.
Woo! Yes.
Situation. So having it a part of your, like you're going to the doctor's appointments when they tell you to, you need to be on that therapy schedule the same way, because it's just going to set you up for success when you really need the coping skills.
And I also do want to mention this too as well. I believe, I say before, I want to work myself out of a job. Like I think that therapy, absolutely, I'm a huge proponent for obvious reasons. But I also feel like therapists can also fit a season. A season or an experience that somebody is going through their lives. I have had multiple clients that have been seeing me for for a specific thing, right? Something else comes up, and could I help them? Absolutely. But I've also referred them out to specialists who I feel like at this season in their life would be better suited to support them through this next level of change, right? Or this next season of growth, which I also feel is very, very important too. Like I'm not knocking on anyone, but when I hear, I've been seeing my therapist for 12 years, I just kind of have to think about that a little bit. It can, not here, neither nor neutral, good or bad, but I want to be able to work myself out of a job. That is always my goal as a therapist.
Yeah. For both of you, and this is going to be like insider information for me too, because I need to be better about how I partner with therapists and making that relationship more meaningful. But at Missing Pieces Support Group, we talk about it a lot, about the importance of community, and we are proponent of grieving and moving forward in community. But how do you see peer support organizations, support groups, and therapists working together to create a more complete ecosystem, support system for grieving parents? Abby, would you like to go first?
Yes, okay. But I was also trying to,
Oh, okay.
Sorry. I got so excited there. It's hard to see Amy's eyes and know which to go. So I think it's vital to have community support, and I'm always looking for places to partner with. I find as a therapist, as a psychologist, it's very hard to get a group together. Everyone has like a different time. Mm-hmm. I have an idea and I have 3 people, but none of them want to come in or be online at the same time ever so far in 12 years of being a psychologist. And I think community groups are vital. So I don't know. I mean, in my happy, ideal Abby world, there would be like peer support in all sorts of communities. And then I would know who the folks are. So I could know if, a client of mine could go with a particular group
Mhm.
Maybe there's also a peer support group for therapists so that they don't have to be in the same group with their client, which is messy.
We have that in Missing Pieces community. We have a support group for healthcare professionals who encounter this type of loss. So, yeah, yeah.
Yes.
So I think your response is actually kind of spot on in knowing who to refer to
Yes.
when your patient needs community support. What, Amy, what's your take?
I mean, I don't think that you can have one without the other, right? The most important part of therapy is the alliance, right? It's the relational aspect. And so what we do in session, which, depending on the client, still a very short period of time in the grand scheme of hours in the day and the time that they have, the real catalyst and magic starts to happen when they start to use those tools out in the wild. So to be able, I say out in the wild, it's just formulaic speak. Abby, I'm sure you've heard it before.
I mean, we say it all the time.
Right? Yeah. So when we see clients out in the wild, and the value of not only the community supports, right, but Missing Pieces as a whole, I know that you are expanding and trying to offer these groups to be more inclusive and accessible, right, online and different varying times, and to be able to know that you are I feel confident sending clients in that direction, right? Because character and ethics are so critical in our field and also in where we refer and how we refer. And I would cut for my clients, you know what I mean? And so I do pretty intensive vetting before I would do anything. And so to be able to say, hey, I'm here for you. I see you. I'm here to support you. I know of this organization that does all of these wonderful things, that works within pregnancy, loss, and grief. Not only be able to do that, but I don't know about you, a lot of my clients are looking for that purpose and that passion, right? They want to find an organization they can volunteer with, that they can give their testimony to, that they can give their story, that they can talk their story and their truth, right? And what their experience is. And that in itself is so cathartic, right? So it serves so many purposes, I feel like, within the healing process with what I've seen with my clients personally, that you one without the other. It's, it's peas and carrots, so to speak. Like they both play off of each other incredibly well. And I think that they strengthen one another in that process.
I agree. Can I just?
Yeah, go for it.
Sure. Woo. Okay, thank you. I think if they're peer led, they need to have a strong leader like you.
Yes.
I think I've often sent people to peer leaders who can't hold the conversation. They can't hold meaning they'll go off into their own story. They'll lose the folks. They'll let infighting happen.
Yes.
They'll have like looser boundaries that are appropriate. So that's what makes me careful when it comes to peer led. I'm like, okay, peer, but is there someone who has either experience in peer led combos or has training in it, or can we meet and talk? There's also a lot of rules that I set up because I love group therapy. Like I have extra training in it. And when I used to facilitate groups before I was licensed, it was so meaningful. So I love the idea that you could also have like a process group or even an EMDR group where people could, EMDR, you don't have to share all the details to get a lot of healing. Same with, I do Phoenix Rising yoga therapy. You can be in your body and you don't have to share what it means to you to get a lot of healing. So you can be in a group, but have your own experience too. Things like that can be helpful as offshoots. And then what's the other thing? Oh, and I also have a lot of autistic clients. And so I find that the kind of sitting around staring at each other thing might not work so well. Maybe there's a chat function where people can talk to each other that way, or if something that's super emotional, it's hard to sometimes speak it. I mean, there's the fear of not being heard, but then there's the physicality of getting the words out. Some of my folks go non-speaking when they get stressed. So having, a place to type it in could be more helpful. Or adding movement, adding different ways of like seating could be really helpful. So I'm always looking for that. And I'm looking for, queer and trans support where I don't have to ask at each thing, So are you okay that this person is in a polyamorous relationship
Mhm.
and that they're struggling with different partners accepting different pieces of this grief, or they identify as non-binary? Can you hold their pronouns? Can you
Mhm.
correct other people so they don't have to do it themselves and
Yep.
cause that kind of pain? We are the conduits for them. Like,
Yes.
the "I'll cut you" to me makes me
Yeah.
laugh. But also I'm like, yeah, that's totally true. I will vet like nobody's business because I have the energy to, when
Right.
I meet my clients, myself, who knows? My clients, I will do anything that I possibly
Heard.
my clients, whatever it is, myself, I'm working through, and I'm usually pretty good, but so much of the energy that I garner, so much of the hope that I have is to, serve my clients well.
Yes.
Agree. I love it.
Chill bumps.
Okay. One more question for both of you. For someone listening today who feels stuck in grief or wonders whether healing is actually possible, what would you want that person to know?
Oh,
Yeah.
it's because I could rant for a while. So
Amy.
I'm going to keep it short and sweet because I always start with the same thing. And I just say, please give yourself permission to feel better.
Love that.
That's where I start, and it leads to a lot more. So, yeah, give yourself permission.
Okay. Abby.
I like that a lot. I get all weepy. It's okay to have help, even if you don't know what the help looks like, even if you don't think you should ask for it, even if you think it could be worse, even if the grief is not about the loss of an actual, like a full person or a fetus or whatever, even if the loss is about an expectation of what you thought parents would be like, or who your kid would end up being, or anything like that, that a therapist or a community member will be right there with you to help you figure out what the next bit of support looks like.
Yes.
You're not alone.
And those are the perfect words. People that are going through this want to know that there are people that will come alongside them and they will understand when they don't even have the words to verbalize what the heck is going on.
Yep.
So, man, thank you for those responses. They fill my heart.
Oh.
Abby and Amy, where can our audience find you online if they are interested in becoming your clients or just to connect with you?
TwoRoadsRecovery.com. I would like to say that I'm super active on socials, but I'm really not. I am not influencer material. I don't have the bandwidth. When I'm not seeing clients, I am gardening, playing with my dog, and not on the interwebs because I have to have boundaries. So yes, reach out to me at Two Roads. I mean, that's the quickest contact way. I check messages, but again, I really try to practice what I preach with my clients, and I'm like doom scrolling and bedrot and all that. Like I just, social media is just not really it for me. Like I'm there because I kind of have to be marketing, but outside of that, yeah, at TwoRoadsRecovery.com. It's gonna be the easiest way.
That's awesome. So my full name, I don't think I put it there, is Abby Weissman. I'm at wavepsych.com. So W-A-V as in Victor, E, S as in Sam, PSYCH.com. I have to spell it out because it took me years to learn how to spell psychology. And I don't want to torture anyone with it. And then I'm more than one wave. Some people get lost and they go, that's a whole nother practice that does a whole nother thing.
Oh boy.
But we also provide continuing education for psychologists and other folks in the USA, and I think parts of Canada as well. I love being active everywhere. I think my heart recently goes to pride marches and pride celebrations, where we were last couple days ago in Oceanside, and we had a table and I got to hear people's stories as they came and shared what pride meant to them and how they could feel heard and seen. So on our website, there's a chance to explore all of our media and to make an appointment with us. We also provide letters for trans folks who are looking for surgery. I'm in California, so folks just need a letter or 2 letters in order to access some life-saving surgery. And while I only see people in California right now, who knows? It could be changing. So please reach out.
And we'll put both links to your practices in our description area of this podcast, so people can find you there as well. Thank you both so much for sharing your expertise, your insights, and your hearts were on your sleeve. Thank you for sharing your hearts with our community. Conversations like these help us to normalize talking about grief and loss and increase awareness about pregnancy loss, because most people don't even know it exists until it happens to them. So I thank you both for your time. I thank you both for sharing yourselves with us. Have a great day.
Well, thank you.
Thanks.